Hello and welcome to the Third Sector. I'm your host, Tamara Brinkman. In our society, there are three sectors: the public, the private, and the nonprofit. And it's that third sector that we are here to talk about today. My guests joining me on the show today are Amanda Wilson, the Executive Director from JACY House, and Dani Arthur, the Executive Director from Oak Park Learning Academy. Starting with us today is Amanda Wilson, joining us first in the episode. We're so happy to have you. Thank you so much. Welcome to the show.
Thank you for having me.
So you are with JACY House. You are the Executive Director. Would you want to just kind of kick off by letting us know when did JACY House come into the community, and letting our viewers know, what is JACY House? What do you do?
Our center was opened back in 2002 by a group of individuals that saw a need in our community. And so we've been around for quite a while now. And we provide lots of different services in the community and across 6 counties here in eastern Indiana. We provide forensic interviewing for children. We provide advocacy services for children and families. And then we provide education for children and adults. So lots of different things that we have.
For our viewers, we've had the website up on the screen. So if you're looking for some more information about JACY House, you can take a look at their website. Tell us a little bit more about how has we're coming out of a global pandemic. Hard not to talk about that. We know that everybody was stuck inside for long periods of time. Kids were not able to go to school, and you're working with kids that are in difficult family situations. They're maybe being physically or mentally abused. How have what it is that you guys do had to change, or as the need increased that you've seen?
We had to make some adjustments to our services. Providing the forensic interviews, we had to continue to provide those to make sure that those kids were able to share their experiences and start that process of making sure that they're safe. So we made some accommodations within our building, safety precautions, just like every agency did. We couldn't go virtual for that part of our process. So we were able to make lots of accommodations, do lots of safety things in place to make sure kids and families and our staff were safe throughout that process. Some child advocacy centers across the country saw a decline in their forensic interviews during the pandemic. We did not. We actually saw an increase in the need for forensic interviews. And I think that says a lot for our community and our ability to report our concerns about child safety. So I think that's super important that we were able to do that and continue to provide those services. Our other services we had to make some adjustments to those. Our body safety education, it really a huge turn for what we were doing. Typically, we are in person in the classroom, sitting there talking to children, sharing body safety rules, getting their feedback, getting their interaction with the program. And that was a big change for our staff and for the kiddos with our traditional education system, but also with our body safety education, to make that adjustment. But through the support of the community, we were able to kind of make those adjustments. Kids were very resilient in that process, did a great job with the program, still participated, had a lot of fun with the program. But we're really looking forward to getting back in the classroom more regularly in this upcoming school year. We miss the kids. We miss talking to them and learning from them and teaching them, the safety rules that they can grow throughout their school career and throughout their lives. So yes, the pandemic hit us pretty hard. Our staff was really, just like any staff, and working with children and working with the community. It was stressful. But we work with a great team of people in the community, and we're able to get through most of that pretty well and continue to provide all the services that the community needed during that time.
Yeah. Can you, for myself and for our viewers, maybe you were just talking about the forensic interviewing, and then body safety. So separately, take one first and then the other, but maybe provide a little bit more of an idea for the viewers. What exactly, for what you can, is a forensic interview? What's involved in that? And then I think, separately for body safety, maybe some examples of, because it's the what's okay, it's what's not okay. So maybe people can give us a little bit on that.
Absolutely. Forensic interviewing is just a really fancy title for having a conversation with a child where the child gives us all the information. We don't lead them in any way. We don't ask leading or suggestive questions. We just allow them to share their experiences. Typically in our circumstance, it's what triggers them to come to our center is those allegations of sexual abuse or physical abuse or neglect. But we allow kids just to share their experiences and learn from them what's going on in their lives, so that all of our team members, our law enforcement agencies, our Department of Child Services, our prosecutors, our mental health agencies can then put those services in place to protect those kiddos and help them to grow through that experience. So forensic interviewing is basically just a fancy way of saying we just sit and listen to kids. Our body safety education is a passion of mine. That's how I got started with JACY House as a volunteer. Back in 2007, I started teaching the body safety program. And it's a program that gives kids the tools that they need to share with adults what's going on in their lives that might not be a safe situation. We can't put the responsibility of keeping children safe on the children. It's our jobs as adults to keep kids safe. But there's some tools that we can give them to empower them to have the language and the ability to share with adults when they're in unsafe situations, or when something makes them feel uncomfortable, or something makes them scared about something, or worried about something, worried about a friend. We give them lots of tools that will carry through all of the body safety rules. There's 5 body safety rules. They start from pre-K and go through 12th grade. And they build on each other. Each year it's the same safety rules, but they build and grow as the child matures and encounters new situations throughout their lives.
Both are really very important programs to have in our community. Sort of takes me to my next question. Maybe you can talk a little bit about, you mentioned that you work with a lot of people in the community, lots of different organizations. What is JACY House's impact to the community? And what would happen to our community if JACY House wasn't here?
Before JACY House was in our community, we really struggled at investigating child abuse allegations. And as far as I'm aware, that there wasn't really any organized methods of providing body safety education to children. And when we don't have an organized process, we call it the Child Advocacy Center model. It was created by Bud Kramer in 1984 in Huntsville, Alabama. And we realized that we were doing children an injustice in investigating when they shared information about things that are happening to them. Children had to repeat their stories over and over and over again, sharing their information, ask questions in many different ways, some leading and suggestive, which made it very hard to prosecute those individuals that were hurting children. The Child Advocacy Center model, what it does is it keeps that trauma-informed approach, that community approach. We work as a team with all of the individuals I talked about earlier, the law enforcement agencies and the Department of Child Services and mental health agencies, medical professionals, to all work together to gather the information through that forensic interview so that they don't have to be interviewed over and over and over again. So if we weren't in the community, if an agency like ours wasn't in the community, children would then be more traumatized by the process and really struggle with their healing from the events that had happened to them. So it's very, very important. In Indiana, we now have 24 child advocacy centers across the state, and there are hundreds throughout the country that follow the same model to make sure that we're doing the best we can for children.
Yeah. So with all of this wonderful work that you guys do, how are you guys, you're a nonprofit, so tell us a little bit about how you guys are able to fund all the work that you do. Whether is it public, is it private donors, is it state or federal funding, combination? What helps give you guys the dollars to do the job on year in, year out?
It's pretty much all of what you said. We have federal funding that comes through the Victims of Crime Act, which is a fund that is being depleted, and there's hearings in the near future on replenishing that fund and providing those dollars to local communities to be able to keep doing the work that we're doing. We get state dollars through the Department of Child Services and other agencies, but we also, what gives us the ability to provide the education and the community outreach and all of those services are our local foundations, our local nonprofit granting agencies, our community donations from individuals. We have all kinds of different support from the community that really gives us that ability to get out in the community and make a difference one-on-one with individuals.
That's great. We just had the website up again as we're coming into the last couple minutes of our time today. I did want to ask you, so for those of our viewers that are listening and watching this, if they're like, I'd love to do something, I want to get involved, what's the best way to do that?
They can reach out to us through our website. There's a volunteer section on there, our contact us section. There's a donate button. You can donate financially. You can donate your time volunteering and coming in and helping with all kinds of different activities and from helping to maintain our building to working with families and all of those different things.
That's great. So what's up next for JACY House?
We have a lot going on. This year has been a huge growth for us. Even through the pandemic, we have had amazing support from the community. We are growing and growing. I said we serve 6 counties here on the east side of Indiana, but we are actually expanding into a new building. We're going to have 2 buildings now. We're going to have a primary building that we're moving into, and then we're going to keep our other building for overflow services and additional services that we're hoping to grow for the community. So we've got a lot going on.
Oh my gosh, very exciting. And the expansion is wonderful news. So congratulations on that. I want to thank you, Amanda, for joining us today and sharing all the great news about JACY House and all the work that you're doing with the community. We're just so fortunate that a nonprofit and an organization like yours is here to support our kiddos and families in this community. Thank you so much, Amanda. When we come back, Dani Arthur, the director from Oak Park Early Learning Academy, will be joining me. Welcome back. Dani Arthur has joined me to talk about Oak Park Early Learning Academy. Dani, thank you so much for agreeing to join me and come on to Third Sector and talk about Oak Park Learning Academy today.
Thank you for the invitation. Oak Park Early Learning has been open for nearly 6 years now, and it is the registered child care ministry of Oak Park Church. Back in 2015, my husband, Pastor Kevin Arthur, had been receiving a lot of phone calls in the community asking us, would we consider reopening the daycare that had been open previously? Mm-hmm. And at that point in time, we just really thought, well, we have the facility, but really, is there a need? And so after doing considerable market research through 2015, we really discovered that Richmond did need additional childcare seats. And so my research really at that point began to go more to the state level and I began looking at Indiana's Paths to Quality Childcare rating system. And what I discovered back in 2015 was that of all the daycares in Richmond that included licensed home daycare centers, Head Starts, the public school, licensed home daycares, other registered ministries, only 50% of all childcare providers were actually participating in Indiana's high quality rating program. So that's when we launched it and said Richmond needs not only additional childcare seats, it needs more providers participating in a high quality program. Yeah. And that's what launched our adventure in providing daycare opportunities, early learning environment for children in Richmond.
Yeah, huge need in this community, a safe place for families to be able to take kids for care so that they can work and they can have, you know, a good home life. Tell us a little bit about the age range that you guys support at Oak Park.
Absolutely. So our program takes care of children ages 6 weeks up through school-age children age 12. When we launched, we were not going to open with an infant room because infant rooms they're very costly to operate, and the ratio for an infant classroom at Paths to Quality level is only 1-4. So we thought, let's not get started down that road. But what we found is that the moment we started to open and advertise that we were opening the daycare, we had more parents calling, do you provide care for infants? So that made us take a fresh look at it, and we decided to open up with one infant room. We did not even get that room completely opened when we had literally enough requests to fill 2 classrooms. So we responded and we opened 2 classrooms. And so since that time, we've offered 8 infant childcare spots. Then we received a grant and we were actually able to double that. We're one of the few providers here in Richmond that actually can serve up to 16 infants.
Wow, that's a lot of little kiddos.
Yes, it is. Yes, it is.
My goodness. What's the mission of Oak Park Learning Academy, Early Learning Academy?
Yes. Well, Oak Park, our mission statement is to grow exceptional learners for social and academic success, not only today, but we really want to consider their tomorrow as well. We really want to infuse children with, if I could just say, a love of learning, so that it would guide them through making strong value decisions, take responsibility for their learning into the future, their own education. We really want to provide a curriculum that really seeks to strengthen the emotional, physical, cognitive, as well as the spiritual needs of children. A large goal, if I could say, is to make sure that children are ready to enter kindergarten, which is, I know, a key, if I could say, a key focus for Richmond's community is making sure that our children have the needed kindergarten readiness skills so that they don't need to be retained in kindergarten.
Yes.
So that's one of our big goals, is making sure that we're providing children with the curriculum and the learning opportunities from the infant classroom up through our pre-K program. And then ensuring that those skills are staying strong through our summer program for our school-age kids, etc.
Yeah. So you brought up school-age kids. Right. Do you want to tell us a little bit more about what's available at Oak Park for more of the middle-aged level kids?
Right. Well, we were really excited by our school-age program. We did receive a grant through the Lilly Foundation that enabled us to go in and completely, if I could say, retrofit this entire classroom. It allowed us to purchase all brand new furniture, develop completely develop the 10 learning centers that we need in every classroom to be in paths to quality, but we've also been able to add a technology to this classroom. So we have the tablets that provide educational learning games. We have the 2 computer systems, as well as a media system in there for just those brain breaks. So the room is really a phenomenal room. Those kiddos also have access to a full-size regulation gym. So with our school-age kids, we don't want to, if I could say, we don't want to completely cookie cut and mimic their school day. We want to provide structured learning activities, but we want it to be more free-flowing, choices provided to them, and plenty of outdoor activities and gross motor activities. During our summer camp program, we also try to get the kids off the campus for different field trips, whether it's going to the Cope learning environment, or we take them swimming or kayaking. We've done a lot of different things through the summer with our kids.
Oh, those all sound like fun activities. I'm in if
Absolutely.
I were a kid. I'm an adult, so it all sounds really great. So question for you, because you mentioned this at the top and then you were just talking about it again, and that's that paths to equality.
Right.
Would you be able to maybe high level explain a little bit about what exactly does that mean? So for our viewers, and they're wondering about, well, my daycare, I don't know if they're paths to equality. Are they, aren't they? Is it important that they are? What if they aren't? You know, what little insight for our viewers maybe?
Okay, so high level, Paths to Quality has 4 rating levels. It's operated through the state of Indiana, and it really is a program that you have to voluntarily agree that you're going to participate in. So high level, I have a rater from the state come into our program once a year, and they are looking to make sure I've met the different qualifications.
Okay.
So Paths to Quality Level 1 really is looking at your health and sanitation and basic regulations.
Okay.
Are you highly adhering to those? Paths to Quality Level 2 really gets to begin looking at your classroom environment. Do you have 10 learning centers? Are those learning centers adequately equipped with enough toys and learning activities to make it a rich experience for all the children? It begins to look at the education level of your teachers as well. Once you hit Paths to Quality Level 3, they really are looking at your curriculum. Are your teachers writing lesson plans? Are they developmentally appropriate for all age levels? Then they begin looking at the teacher's education as well. 50% of your teaching staff at Paths to Quality Level 3 needs to have either their early childhood degree, their child development associate credential, or they have to be working towards it and have obtained at least 60 hours towards it. Level 4 is you're accredited with whether it's NACY, a national organization, or a faith-based accrediting association as well. So it kind of goes from the state level to an outside level once you hit Paths to Quality Level 4. Why is it important? It really ensures that your children are not just being babysat. That they're not just in an environment where it could be caring, nurturing, loving, but they're just being supervised. Paths to Quality says that this is an early learning environment, which is absolutely essential for the development of our children in preparing them for school.
Oh, it is. It is nothing short of essential, and it is really important that we have organizations like yours in our community with those ratings to be able to provide that level of education and learning and care for kids and families. You also mentioned the Lilly Grant Fund that you received. So tell our folks a little bit about how do you guys fund your work? So the programs, the facility, obviously a grant, so that helped with some, but how do you do it all?
So obviously our daycare operates predominantly on tuition and registration fees paid by our parents.
Mm-hmm.
When we started the daycare, though, we wanted our program to be affordable for all families,
Mm-hmm.
whether they were in a lower socioeconomic group, so more of the poverty,
Mm-hmm.
or those in what is considered to be the ALICE group,
Mm-hmm.
asset limited, income constrained, and employed. So when we began looking at how could we ensure that our program was affordable to everybody, then of course we started to participate in the state of Indiana's Child Care Subsidy Program, which here is called the Child Care Development Fund, and it's administered through the Children's Bureau.
Mm-hmm.
So parents that are working or going to school but have a lower household income would qualify for CCDF vouchers.
Okay.
But then there's a cutoff income level for that. And what we found is that our student body, we had a lot of children enrolled that were CCDF participants, and we had higher income families. We were really missing that middle group. That really, after paying all of their living costs, they really just didn't make enough money to be able to afford a higher quality childcare program. That's when we began to seek grants.
Okay.
So we do receive grants from like the Lilly Foundation, from the United Way of Whitewater Valley. And there have been different grantors that have provided us money that have allowed us to provide in-house tuition scholarships.
Right.
And currently that is providing 10 more children that receive a weekly discount to be able to come to our program that may not have been able to afford us otherwise.
Wow.
The Lilly grant has provided us with grants for our school age program. And so that's kind of what we try to go after.
Yeah. Well, I mean, it's hard to get all that funding, but it's great you guys are out there, getting it where you can and taking those grant opportunities and moving the ball forward here for our kids and families in the community. Dani, I want to take a moment to thank you. We're out of time today. As we wrap up this episode of The Third Sector, I'd like to thank my guests, Amanda Wilson from JACY House, and also thank you again to Dani Arthur from Oak Park Early Learning Academy for joining me today and sharing with the community the great work that they do. Stay well and see you next time on The Third Sector.